Have you ever had a poor night of sleep? Let's say you woke up on the wrong side of the bed, or let's say the night before you were just restless all night long. You were just tossing and turning and never able to actually get some restful sleep. Maybe you had insomnia and you just stared at the wall or the ceiling for the last couple hours. Well, that affects your entire day. It affects the next day, it affects your relationships with the people around you, it affects your work at the office, maybe. It's just absolutely terrible to see the long term effects of having poor sleep, having poor rest, and what that does to a person in the long run. And so today I'm going to be talking with Northern Nevada Medical Group expert Carrie Yamamoto, and she actually is the absolute expert about sleep, sleep apnea, and specifically, and other things regarding poor sleep, how to improve sleep, and I'll be asking her about all those questions today. So we're doing this presentation here on YouTube Live to help get some of your participation and some of your involvement in our conversation today. So if you're watching this and it's pre-recorded, I would really encourage you to subscribe to the channel. That way the next time we go live, you can help participate in this discussion that we have. For today, if you're watching this live, thank you, and we want you to participate, so be sure to use that chat box to ask any questions you would like to Carrie Yamamoto, and I will moderate them and help ask them to her, and then she will come back with those answers for you. If we don't get to your questions right away, please rest assured that I will get to all the questions afterwards to help answer those. My name is Alex Sampson. I'm with Health Benefits Associates. We help people with health insurance plans and Medicare plans here in Northern Nevada. We have offices here in Reno, Sparks, and in the Carson Valley. And we'd love to help you with any of those plans. But today we're actually just connecting you with doctors. So the whole point of these presentations through Hello Health is to connect you, the members in Northern Nevada, with doctors and providers like Carrie Yamamoto I'm going to be speaking with upcoming here. So we have another series of presentations that's going to be coming up starting September 15th called Mastering Medicare. Now these are series having more to do with Medicare specific changes here in Northern Nevada. There are a lot of them coming out. We want to help explain all those to you. So just in case, even if you had the same Medicare plan from year to year to year, we definitely want to take a fresh look because there's nothing that stays the same in Northern Nevada. Everything is always changing here. So without me getting too far into it, let me introduce Carrie here and we'll get started. Carrie Yamamoto has her Master's of Science in Nursing. She's a registered nurse, acute care nurse practitioner, and critical care registered nurse. Very impressive. She received her Bachelor's of Science in Nursing from Saginaw Valley State University in Michigan, and a Master of Science in Nursing from the University of Rochester School of Nursing in New York. Prior to joining Northern Nevada Medical Group, she served as an advanced practice nurse practitioner for a local pulmonary and sleep medicine clinic. Carrie has 11 years of experience as a critical care nurse prior to becoming a nurse practitioner, specializing in medical, surgical, cardiac, and neurological intensive care. Lastly, she is certified by the American Association of Critical Care Nursing. So I'm going to bring Carrie in now, and we're going to ask a couple of questions. We're going to get her opinion on how important sleep is in her life, and go from there. Carrie, are you with me?
I'm with you. Hi, Alex.
Hi. Perfect. And thank you for joining me today. It's just absolutely wonderful to have you on. And I know that sleep is so important in people's lives. And we kind of talked about it a little bit before. But tell me, like, how do normal patients come in and they get diagnosed for sleep apnea?
Typically, I get lots of referrals from primary providers. Patients typically have symptoms such as fatigue. They are not sleeping well at night. My last patient was 42-year-old male. He's been waking up 10 to 20 times at night for multiple years. And so oftentimes it's the wife that says, I can't stand your snoring anymore, go and see somebody. Sometimes it's because they're so tired during the day and they just can't get through the day. They're requiring a nap, multiple naps, long naps. So those are typically big key points that our patients are being referred to me.
Perfect. So after they get that referral, they come in, they see you, and then what's the next step? Do they take a test? I mean, I've heard a lot about patients needing that in-clinic test. Is that most of the time, or how often is that happening?
So what happens is I do a very detailed sleep assessment. First, I ask very basic questions like, do you snore? Do you have restless leg? Because that's part of, potentially having untreated sleep apnea as well. And then beginning to really detailed sleep questions like what time do you go to bed? What time do you wake up? How many times do you wake up in the middle of the night? Do you take medications or substances to help you sleep? After we discuss it in clinic, then I determine that yes, I do think you're a candidate to have a sleep study. 98% of the time, my patients can have a sleep study conducted at home. It's very few if, of patients that actually have to go into a lab, which patients are really thrilled about, and I am too. So first step is the home sleep study is where I can get an actual diagnosis.
Okay. I've got one question from Nate here, which you might have answered a little bit already. So, how do I get tested for sleep apnea? Can you get tested at home, or do I have to go into a facility? So you kind of answered that. Is 90% of the time they can get tested at home?
Yeah,
Is that
you
right?
have to have a pretty, it's typically specific medical diagnoses that warrant a in-lab sleep study. And then if you're on, let's say, CPAP treatment and treatment isn't going as well as what we have wished, typically I discuss with the patient in great detail because the patient helps me just like I help them. We determine the next steps of plan and if an in-lab study is the best route for them. And that's the other percentage of why patients have to go to the lab to get another sleep study.
Got it.
So
Okay,
yeah,
perfect.
first diagnosis, home sleep study.
Got it. Perfect. Um, from Guadalupe, he says, "What is the typical timeline from testing to diagnosis to treatment?" So how long are we taking for this entire process, or does it vary?
That's a great question. So every place is going to be a little bit different. I feel like Northern Nevada does a fantastic job with their timeline. So coming to see me, I will place an order to a sleep center paired with your insurance company. So there's a couple sleep centers in Reno and Sparks, and we pair them specifically with your insurance. They contact you within about 2 weeks to get you scheduled.
Yeah.
Then the sleep study in your home can typically be conducted within 4 to 6 weeks. And I do my follow up appointment in 2 months. So
Got
from
it.
my first appointment to your next appointment with me is in 2 months. And I like to actually just do a phone call for your sleep study results. I've had patients on literally on vacation in a different state while I'm talking to them about their sleep study results and what the treatment plan, discuss their treatment plan in detail.
Got it. Okay, great. And you know what? That just, I mean, do you see when they come in for that second visit? Just my personal question here: are they significantly different? I mean, do they experience that kind of wake up session where you're seeing that their sleep is significantly better using the CPAP machines or using the treatments that you're talking about?
So once I get the patient once I discuss the home sleep study with them and we determine what treatment option the patient wants to pursue, because there's four treatment options. So, oftentimes patients think that if they have sleep apnea, that the only option is a CPAP machine, and that's not true. The gold standard is a CPAP machine because it's 95% effective, okay? The other 5% are patients that just don't tolerate it, and it's completely understandable. A lot of times patients come into me and say, I don't want that Darth Vader thing on my face, or I'm so claustrophobic. And I reassure them that even if this is the only option that they can do, I will work with them very, very closely because I want them to be successful at this. And this is not an easy task.
Yeah.
I would never be a provider that says, hey, you're on CPAP. Good luck. We'll see you next year. No, I have a follow up visit with them 6 weeks after starting on the machine. I don't expect them to be sleeping on the machine the first week or the second week, maybe not even the third week all night. My expectations with them are that they're at least trying it every single night because it takes time to desensitize your brain from having something on your face if we do pursue with the CPAP machine,
Yeah.
does take time. And I do want to point out that there's lots of different masks. The companies are coming out with much more comfortable ones. I have a lot of older men that are coming to me that tried the CPAP machine 10, 12, 15 years ago, even 8 years ago, and they're coming back because number one, they have medical problems that are prompting them that the doctors are like, you need to go and get treated for your sleep apnea. And number two, their wife can't stand their snoring. So the companies have come up with these more comfortable, convenient masks. And I actually have a little demonstration for you today. So look at this one. This is one of the newer ones that Fischel and Paykel just came out with. It actually if you look at it, it kind of fits like a baseball cap. Okay. Obviously, this is going to go right under my nose, and I'm not going to necessarily do that right now. But then it fits right underneath the nose. There's your looks like an elephant nose right here, right? But this is all it is. How neat is that? About a third of my patients like a nasal one, okay? Then a third of my patients still like one that's over the nose and over the mouth, okay? And then the other third of patients like the other styles, because even if it's a nasal one like this particular style, there's other different companies that make a nasal mask. So another two other different styles are under the nose, over the mouth, and then the other style is just over the nose completely. The one
Got
I've
it.
showed you is just under the nose. So
Got it.
lots of different styles, and it's not one size fits all. You'll get fitted with a mask. It's going to fit comfortable, not painful. If you're turned from side to side, it's totally normal for it to shift. You just shift it back into place and go back to sleep. And like I said, I'm not expecting a patient, if we do pursue the CPAP route, which again is the gold standard for treatment, to be sleeping all night with this. But I expect them to be trying at least an hour or two every night. And then in due time, their brain will be like, oh, you're okay with this on your face. Okay, we'll go to sleep then, because what happens is your brain thinks there's a big bug on your face. It truly does. So even if you, let's say, fall asleep one night and you fell asleep, you got like probably 4 hours with the machine on, and you thought you were doing great, and you woke up with a cough. Okay, that's totally okay. It's totally normal because your brain was again thinking there was a bug on your face or it was leaking. So your your brain's like, get that off. It's like leaking into your eye. Oh my gosh. So in due time, as you get used to the machine, which is why I come into play after 6 weeks, so we can talk about this, talk about the norms, and adjust the the pressure. I adjust the time on the machine. Lots to be discussed at the first appointment after you start on the CPAP machine.
Perfect. Perfect. Well, just a couple other questions. So I have a question from Guadalupe again here. It says,
Yeah,
are you going to be at the new hospital? So will you be still at the hospital where you are now in Sparks, or will you be moving, or do you know?
that's a great question. I don't know the answer to that quite yet.
Okay.
I'm hoping if we can, I can be split at the two locations because I know that traveling can be an issue for patients. So I'm
Yeah.
hoping to be at both locations. Yes.
Perfect. And one thing to mention too, I have so many clients that come in, and you'd never be able to guess one to the other who's on a CPAP machine. And they want to review their health insurance benefits. They want to make sure that their health insurance plan covers durable medical equipment and CPAP machines and new CPAP machines. And that's something I look up for my clients that are on those machines, but you would never know. It's not that there's one demographic over another demographic that I'm seeing that I can
No,
recognize a clear, oh, I can point out somebody who's on a CPAP machine versus not. It is absolutely impossible. You'd never know.
it really is. So obviously, as time goes on, um, everything kind of starts relaxing as we age, and that includes like the collagen in our skin. So when that relaxes, um, your airway starts to relax more too. Okay. So sleep apnea is essentially when you go to sleep, your airway starts to relax and may close. That's when you start having what's called shallow breathing, or it can completely close, and that's what's called obstructive sleep apnea. Okay. And when this happens, your body does not like that, of course, right? Because your oxygen is actually dropping during that time. So how your body reacts is your lungs constrict and go, oh my gosh, I don't like this. Sends a signal to your brain that your brain isn't getting enough oxygen. Your brain in turn tells your heart to work harder and faster. Okay, so your heart is trying to compensate for the low oxygen. So why this is important and why it's we need to, change that up so that doesn't happen and open up your airway. So when you're sleeping, your airway's open. Is if this is left untreated, if you have sleep apnea, and if it's left untreated, you can increase your risk, or you can make symptoms worse with diabetes, depression, and other mental health, high blood pressure. It's been linked to Alzheimer's, cancers, chronic lung disease, some liver disease, and some kidney disease. It's been linked to heart failure, coronary artery disease. And when you make that heart work harder and faster at night, it can throw your heart into an irregular heart rhythm because after a time, your heart's like, I can't do this anymore. So it kind of goes out and throws your heart into an irregular heart rhythm, which can cause a heart attack or stroke, and with that can cause death. So it's a
Oh man.
very serious disorder, and we don't think of it that sleep is a problem because we have to do it every night. But when this happens multiple hours, when this closure or this shallowness happens multiple times in an hour, and then multiple hours or multiple times in an hour, and then multiple hours a night, and then night after night after night, and year after year after year, your body is in a constant state of stress. And then that, like you were talking about, Alex, when you were introducing everything, it affects your daily living.
Absolutely, yeah. And I think everybody can relate to just one bad night of sleep. But
Mm-hmm.
when you had those multiple like average nights of sleep, if that's your new normal, it's hard to recognize when you get a good night of sleep because
100%.
you just never had one or you haven't had one in years. And so
100%.
I could completely see it. I have a couple more questions. I'm not going to take too much more of your time, and I'm probably not going to get to all the questions. I do apologize. I will get to
That's
everyone's
great.
question via email, but I have one question here. I think I have insomnia. Is that the same as sleep apnea? Could you address insomnia and how that relates?
Sure. So insomnia is different than sleep apnea. So sleep apnea is the closure, okay, of your airway. Insomnia is that you just can't sleep, okay? So insomnia, I also treat here. So what I would like to say about insomnia is that it's normal to fall asleep within 30 minutes when you initially go to sleep. It's also normal to be awake in the middle of the night for 30 minutes. If it's taking you longer than that, it's likely that you have insomnia. So, a couple tips that I like to share with my patients that I often see that people that do have insomnia is that when you can't sleep, patients often stay in bed. And when they stay in bed, they start looking at the time and they're like, oh, it's been a half an hour. It's been an hour. Oh, I can't fall asleep. Oh my gosh, has it been another 2 hours? I have to work tomorrow. Oh my gosh. And then also what they start doing is they start thinking about everything, their to-do list, that conversation they had last year that really, you know, affected them emotionally. And they start thinking about the world problems, you know, what happened during the day a couple days ago. So they just start thinking too much too, and then they start getting more worried that they're not going to fall asleep. And then they look at their clock again. So what I encourage patients to do is not look at the clock because what they're doing is they keep stimulating their brain every time they're looking at the clock. So think of it like having a shot of the strongest coffee every time you look at your clock. Okay? So what I encourage everybody to do is set an alarm every morning and then you never have to look at the clock in the middle of the night. Okay?
Right.
So when you have the alarm set and you wake up in the middle of the night and you're like, I can't sleep. Okay, fine. Then you need to get out of bed and you need to reset your mind and you need to go, okay, I'll say me for example. I have two littles that like to wake me up in the middle of the night. I go to bed between 10:30, 11. I will tell myself it's midnight. I don't look at the time. It's midnight. I have all night to sleep. So that's my mantra. So you need to just reset your brain and say, brain, I'm not going to think about X, Y, and Z in bed. I need to sleep because the only two things you should be doing in bed is sleep and sex. That is it. So my mantra again is that I think it's midnight. Again, I don't look at the clock, but that I get to sleep all night and I can easily fall back asleep.
Yeah. And
Go ahead.
and that's perfect. And I can't state it enough. I think that you exactly said exactly what my mind says in the middle of the night, which was, it's thinking about everything else. I mean, thinking about so many different things that exactly what you're saying. You don't need to be worrying about this right now. This is it. And so
Yeah.
yeah, that's just. I mean, I've heard so many different ways to do it, but I think that you're well, obviously you're the expert in this area, but it's good to hear it
Yes.
right from the horse's mouth instead of me hearing it from some side
Your
source.
neighbor.
Right,
Well,
absolutely.
it's that intuition. If you can't intuitively fall asleep within 20 minutes, get out of bed multiple times. And this is gonna your brain is in this habit that that's what you do in bed. So if you're trying to fall asleep but you think about so much stuff in bed, then you're being like your brain will be like, what do you mean, Carrie? What do you mean you want to fall asleep right now? I thought we wanted to talk and think about the world problems and the stress at work and the stress with family. So
Right.
it will fight you and then it'll make you more worried. So the best thing to do is if you're really, really having trouble, because some of my insomniacs have a lot going on, even with the first few minutes, and I myself have had this before too. Get out of bed right away. Like, no need to sit there and think about, is it 20 minutes? No need. Just get out of bed if you know
Yeah.
it's not a good night.
Right. Right. Perfect. Yeah, because that's not the place you should be stressing about those kind of things at all.
Absolutely. Go on the
Yeah.
couch, write down your to do list, think about the whatever you got stresses, and go back to bed.
Yeah. I'm gonna ask the last question here from Alice, and I apologize if I didn't get to you guys' question, all of you guys' questions. I will answer those via email afterwards here. But Alice is asking, how long does it take to get a test results back? So you kind of answered that a little bit, but would you be kind of, would it depend on their insurance? Would it depend on, the type of test they're getting, or how long do test results normally take?
So test results are typically, it takes about the sleep doctor approximately 2 weeks after you get your test conducted for them to read. And again, it takes, about 4 to 6 weeks to get it scheduled, 2 weeks to read, which is why my follow up is in 2 months.
Got it. Perfect. Okay, great. Well, Carrie, I'm going to let you go so that you can get back to doing what you do best, which is not making YouTube informational videos like we are, but more about treating patients like you do. So I can't thank you enough for participating with us today and answering all of the questions I had and answering personal questions from me. I can't thank you enough, and we loved having you on. Thank you so much.
Yes, absolutely. Come and see me.
Yes, absolutely. And I'll leave Carrie's
I will.
information down in the section below, in the comment section, to make sure that everybody has access to her information down below. And so if you have any questions about contacting Carrie or scheduling an appointment, please follow that link and you'll be able to do so below. We also have another series coming up, I talked about a little bit before, called Mastering Medicare. It's going to be coming up on September 15th, so please tune in to that. In a week from today, we have Dr. Wadi Gonzalez here with Kyle DeVries, and he is going to be talking about cardiology and cardiac medicine, and that should be an excellent presentation, so please be sure to tune into that. Thank you so much. I'm Alex with Health Benefits Associates.